Smoking doesn't automatically disqualify you from passing a DOT physical. But here's what drivers need to understand. The health conditions that come with smoking can absolutely affect your certification, and your examiner is trained to look for every one of them. Let's break down what actually happens in the exam room. Your DOT medical examiner isn't checking whether you smoke. There's no box on the form that says yes or no and ends your certification right there. What the examiner is doing is assessing your overall health, and smoking creates a pattern of conditions that come up on that assessment, whether you mention the habit or not. Blood pressure is the big one. Smoking tightens blood vessels and raises pressure. If your reading comes in high, that changes your certification timeline. Instead of the standard 2-year card, you might walk out with a 1-year certificate, or you might need to come back once it's better controlled. That's not a failure, but it is something to plan for. Heart health is next. If smoking has combined with high cholesterol or diabetes to create cardiovascular concerns, your examiner may need a clearance letter from a cardiologist before they can certify you. That adds time. It adds appointments. It can delay your return to work if you're not prepared. Lung function matters too. A chronic cough, wheezing, or a diagnosis like COPD. Those are things your examiner will want to understand. In more severe cases, breathing issues that aren't well controlled could stand in the way of certification altogether. Now, here's the practical side of this. If you smoke and you're coming in for a DOT physical, don't smoke right before your appointment. Smoking temporarily spikes blood pressure, and you want that reading to reflect your baseline, not what happens right after a cigarette in the parking lot. Bring a current list of any medications you're taking. If you're already being treated for high blood pressure, heart issues, or a lung condition, your examiner needs that information. Controlled conditions with documented treatment are looked at differently than conditions that appear unmanaged. And if you're seeing a primary care provider regularly, keep that relationship going. Documentation of a controlled condition, with records to back it up, makes the examiner's job easier and your certification path clearer. Smoking won't end your CDL career on its own, but the conditions linked to it can slow you down or add steps to your certification if you're not prepared. If you have questions about how your specific health history might factor into a DOT exam, bring those questions to a DOT-certified medical examiner. Or reach out through .modesto.com to schedule your exam and talk through what to expect.